I think it's important to see what's happened, obviously, during, and because you have to look at everything in light of the COVID pandemic. We've had hospitals that have had to divert resources away from things that normally they would have had to take care of some very, very sick patients. What we need to really work on with healthcare in this nation, in my opinion, is to make sure that we have jobs, that people have insurance. And again, this was taking the whole Medicaid expansion issue out of the picture because people had jobs. They didn't have to worry about being between jobs. And so, well, again, pulling our economy back up together again will help bring, in my opinion, health insurance back on top of things. I do think there are a couple things that we need to do in this nation to bring down health care prices. Excuse me. If you look at drug prices specifically, I have two things that I'm going to continue to work on, and that is one, direct-to-consumer advertising, which if we did that, if we dropped that overnight, we could easily drop, in my opinion, about 15 cents off of every dollar that we paid for our drugs. And the other thing is something that most American people don't know about, something called pharmacy benefit managers, which is, again, just specific to the United States, and it's the middlemen. The middlemen who basically starve independent pharmacies, run them out of businesses. These middlemen are run by insurance companies, and what they do is they basically are loan sharks, if you will, that kind of activity to pharmaceutical companies. And it's wrong. It's thrown the healthcare costs of the nation up, more than $1 billion every year. Those need to be brought under much, much greater control, and then we will see a marked decrease in the cost of medications for the average American.